Hi guys, this is Dr. Michael Wong, founder of PhysioU, and I'm excited to take a few moments just to share with you a glimpse into all the new apps that will be part of your journey as you become a rehab specialist. Also, that you'll be able to learn how to get the web app onto your mobile devices and utilize these apps during your education to enhance your clinical reasoning, to develop motor skills, and to use the apps as a quick reference tool. All right, so here we go. So what you just saw was, wow, maybe 6 or 7 years ago, we had just released our first app, and we were learning about how to use these to help the students learn. And 6 or 7 years later, we are convinced that this will change the way you begin to see the world, how you develop your clinical reasoning. You could see that they were using it in class to do case studies. These were basic cases of common patients, and they would use the apps to kind of figure out, hey, what would I do? What is it that I learned? What examination and treatments match this category? What does the guideline say about how to treat this type of back pain? So you saw that person who was doing this backwards extension movement. That's a gymnast who's complaining of severe back pain. So what I'm going to share with you are little glimpses into the apps and how potentially to use it to enhance your learning as you guys continue on your journey. I first want to share with you that PhysioU is a collection of mobile web apps. All right, so yes, even though there are apps in the App Store, we have decided to move everybody towards mobile web apps so that you could use the apps on any device that you have. So whether it's your iPad, your Android tablet, your laptop, your phone, all of it does not require you to use up that precious memory because all of it will stream, and it also means that we can constantly update it. So that's what we do. Yesterday we were working on building 2 or 3 new apps that are going to be awesome, and they just become part of the PhysioU app family. So one of the things I want to help you do so that you could make most easy access to all of these apps on your devices is for you to know that all these web apps work on all of your devices and how you add it. So I put the link here. You will be getting a handout shortly, but if you go to the website, at the website, I'm going to take you there right now. You'll see that at the very bottom of the website, there are some frequently asked questions. And one of the key questions is, hey, can I use this on my smartphone or tablet? And when you click on that, all I want you to see is when you log in on your Android device here, you click on the 3 dots on the side right here, and you have the option now to add to home screen. And boom, you will have a little icon here that is now ready for you to access, just like it was an app. All right? For Apple devices, you would do something very similar. You log into the app, you click share, and you take the option add to home screen, and you add PhysioU web app to your home screen. That's what I use on my phone. So I just click on it, it scans my face, it opens up, and then all my apps are available. Just let me know.
Yeah, we can see it.
Okay, because I'm going to switch back and forth from my PowerPoint to the web app, and so let me know if you can't see it. So what you can see is we have been building apps based on the best research. These are all clinical practice guidelines. So
we just see your chat window, your window.
Oh, weird. Okay, let's do this. How about this?
There we go.
Yeah, perfect. So you can see we've been building a lot of these apps over the last 4, 5, 6 years. And all of the clinical practice guidelines are built into these apps. I'm one of the guideline writers for JOSPT and the Orthopedic Academy of Orthopedics. And so we have thought that this is a much more engaging way for you to learn about the best evidence for practice. You can also see that as we moved on, we started getting faster and faster at building apps. And I'm going to show you a few apps that are especially pertinent to the classes you guys are about to take starting this semester. Okay? So, 3 ways to use PhysioU. The first way is videos. You know, a picture is worth 1,000 words. A video, when it comes to techniques and skills, is worth 1,000,000 words. Imagine trying to read a book about how to do a range of motion assessment or a manual muscle test. Or you could simply watch the video, listen to how the person does it, reference the text below, and learn right away. So it accelerates your learning. We've seen this in our classroom. We've seen this in many different programs. And so let me take you to the Range of Motion MMT app, because I know you guys have that class coming up. All right, so what you see here is I have logged in at PhysioU.com, right? So I've logged in, and here I am at my app selection. So I have all these apps that will follow you throughout different parts of your program. And let's start here at the Range of Motion MMT. It's very likely that many of the skills you're learning, including palpation, so here's all your palpation related to all the anatomy that you guys are learning or have learned. Here you can see an instructor giving you tips on how to find that tissue.
When palpating for the coracoid process.
Okay, and cues for how to do it, what kind of structures might be related, and some common pathologies or kind of conditions that you might be looking for, and how that might play out when you observe patients. So not only are we trying to become the helper of your development of skills, we're trying to help you tease in the clinical reasoning. Why would you look for this? Why would it be beneficial to the patient? So here are your landmarks for bony and soft tissue. And let's just take shoulder, for example, in terms of range of motion. You're going to have a lot of techniques here that you're going to have to learn that are part of your fundamental skill set. So again, the instructor is here.
With the patient lying supine here on the table, we can now measure for shoulder flexion.
You can see that the dots represent the landmarks for typically your axis of motion, your stationary arm, and your movement arm. All of this information is here because we know that different learners like different ways of learning. Some people want to watch, some people need to listen, and some people need to read. Okay, so here are your goniometer landmarks. You're going to be very familiar with these very shortly. Some normal ranges of motion from some common reputable sources, and some keys to reliability, meaning when you finally get to the clinic, here are some things that you have to think about when you're actually doing this on real patients. We also added in one component here, which is it's easy to think of this as just a skill, an isolated skill, but in fact, because we are all part of the movement specialist profession, it's important for you to make the connection. What kind of things is the patient complaining about that usually would invite me to explore range of motion, right? So reaching overhead, oh, that makes sense. No wonder if he can't reach overhead, no wonder I need to measure range of motion to assess whether he has enough, right? So you can see that we've taken great pains to try to connect a lot of dots for you. The same thing you can see here for manual muscle test. We've linked this motion to the muscles that you are memorizing or have memorized. You can watch the video to mimic how this instructor does it, as well as you will have the grade scale and the anatomy table, because we want your learning to be deep and long-lasting. All right, so that's kind of the Range of Motion MMT app. This app also contains your neuro screen. So in many classes, this is part of the fundamental skill sets. You're going to learn dermatomes, myotomes, and reflexes, because this is an important way for us to watch out for, is the neurosystem involved? Okay, so let me take you back to the PowerPoint for a second, and give you a tip on how to prepare for your labs. I think of the way you develop motor skill is a very important process. You don't wait around for lab to happen. You have techniques and videos of many of the skills that you're going to learn in your program ready for you to preview. So all of my students will watch the techniques on their lab handout first, or in their lecture, wherever they are found. They watch it and they try it, because many of these techniques are not high risk. Okay, so you try it on somebody, or you do it. Even when I'm practicing techniques, I'll play air guitar. I will do the technique in my mind, move my arms like I'm doing the technique, stabilize the shoulder, press down on the arm. All of these things I would invite you to do. Why? Because by the time you get to your lab session or your online class, you have so many better questions. You have such a familiarity with the techniques that it greatly reduces your anxiety and prepares you to learn deeper as your expert instructor basically shares a lot of the context. Why would I use this technique? When would I choose to measure this range of motion? All of that is so much better when you have prepared on your own, right? So good learning from responsible students, you take it into your own hands to prepare for class. This is why it's so useful to have all of these videos with you anytime. All right, the next thing I want to share is the idea of developing pattern recognition. So develop pattern recognition. So pattern recognition is a mark of expert clinicians. So when a shoulder patient walks in and is looking at your instructor or my instructor as a therapist, already from the way they move, the story that they tell us, we've already begun to categorize the patient into a clinical pattern, right? Because it helps me to already speed up the selection of tests, selection of investigation, the assessments. I already have an idea what the research says about treating this type of pattern. So what that means for you is when you walk into the clinic, there is a common group of patients that have shoulder pain, and you should be able to recognize those patterns. Okay, so I'm going to take you in there for a second. This is probably a later part of your curriculum class, but it's a very powerful part of the app. So I want to show that to you. So let me come out here and go back to my app. So here is the Clinical Pattern Recognition Ortho app. This is the biggest app of all the apps. So let's take frozen shoulder, okay? Let's take a shoulder problem, for example. The way I do it with my students is they play pain patterns, because this is what the patients will tell you. Hey, I have sharp, deep, aching pain deep in my shoulder. Okay, tell me more. Well, from that pain pattern, I have a few options. Sometimes instability, labral tears, Bankart lesions might be the cause of that type of pain pattern. Sometimes frozen shoulder might be the cause of that pain pattern. And oftentimes, I have to think about the red flags that might refer pain to that area. So this will be tied to some of your red flag screening class. So let's go into frozen shoulder. You can see here that there's prevalence data. This helps you, based on the research, increase or decrease your prediction that this patient sitting before you has frozen shoulder. Okay, so this may be of use to you. There's also a clinical findings video. Now this video helps to describe what these patients look like. So I'm just going to take a minute to let you watch a few minutes of this. Shoulder pain with mobility deficits or adhesive capsulitis. Stage 1, which may last up to 3 months. Patients typically describe sharp pain at end range of motions, achy pain at rest, and sleep disturbances. Note that even though the range is painful, she has full range of motion. An intact rotator cuff on testing of the muscles and early loss of external rotation range of motion is a hallmark sign at this stage. In stage 2, the painful or freezing stage, the patients present with gradual worsening of motion in all directions due to pain, and this can last from 3 to 9 months. The third stage, the frozen phase, is characterized by pain and loss of motion that can last from 9 to 15 months. Note the significant loss of hand behind back motion. The patient may report functional limitations of significant difficulty trying to wipe after using the restroom or donning and doffing their bra. In stage 4 or the thawing phase, the patient reports pain resolution but persistent significant stiffness. Patients are at an increased risk for developing adhesive capsulitis if they have a history of diabetes mellitus and thyroid disease, and it is more common in females between the ages of 40 to 65 years of age who have had a previous episode of adhesive capsulitis in the contralateral arm. So, did you learn something? You know, frozen shoulder presents in lots of different ways, and you treat them different. When they're really painful, you treat them with modalities. You calm down their pain. When they're in the phase where they need stretching, well, when they're really painful, you still do things that are really gentle. When they're in the more stiff phase, it's less painful, you start mobbing them, right? Or you start stretching them. You help them with their passive range of motion. You use low to high repetitions. Or if you think about the therapeutic exercises, so I'm going to go back to here, interventions. Here's a bunch of therapeutic exercises for mobility based on how irritable they are. What stage are they in? Should I do end range stretching like you see here? Not in the highly irritable stage. There I do a lot of pendulums. So what you can begin to see is not only are you able to begin to explore what the therapist would be doing for the examination. So here's the things I would do. I would assess range of motion, right, which is what you're going to learn in this early semester. I would assess accessory glides. Here's my posterior and inferior glides, anterior glides. These are all videos, of course, with guideline-based recommendations for evidence. And you can also explore what would the physical therapist have done for differential diagnosis, right? Oh, I would have cleared the spine. I would have cleared the thoracic spine or looked at some nerve issues. Think about how powerful it is to see the whole picture, from examination to treatment to therapeutic exercise, and including all of these modalities that you're going to learn about. You can begin to see how this can help you develop your clinical pattern. Now I recognize, oh, when someone comes in with shoulder pain, I can look at all diagnoses, and the most common forms of shoulder pain that are going to walk in the door: AC joint sprain, frozen shoulder, the stiff shoulder, the unstable shoulder, labral tears, slap lesions, or shoulder impingement. Those are the 4 main categories that I teach my students. You can learn that too. It's your responsibility to explore the types of patients that you're going to see in the clinic and to become familiar with those patient clinical patterns. Okay? All right. And so in my last 10 minutes here, actually last 5 minutes or so, and then I can take some questions if needed. PhysioU is a fantastic quick reference guide. All right, this will come in very handy for your physical agents class, your assistive devices, transfers and gait training class, lines and tubes. So if I give you a glimpse into modalities app, the physical agents app, so I'll go back here. I'm going to scroll down towards the bottom. Here is my physical agents app. You're going to learn about a bunch of cool physical agents, okay? Like mechanical traction. The best way to learn it is to read about it, understand what it's for, and why you might need to do it. It's very important for you to understand who you should not do it on, right? Contraindications, and how to make sure you can screen those contraindications with good questions. There's precautions that you want to be aware of, right? And here is how you ask about those precautions. And here's the setup. So you have a video of me describing how it's done. First, prepare the traction table. Attach the cervical traction unit to the main device. So think about this. Before you go to lab, you can already preview the video and prepare your mind for lab. When you get to lab, you can switch to the high-speed video and watch the review of the entire video, but it's silent and it's quick. Or you can use the gallery and clip through the pictures just so that you can actually get busy using the device. It will make your learning in lab so much more efficient. Part of our job as therapists and therapist assistants is giving good patient education. So we have our students read all of this. Why do we use it? What does it feel like? How can I do this at home? This becomes something actually that you can deliver to the patients using this little mail button up here. And there's always case studies that you guys will be able to use to develop your clinical reasoning. Okay, so that's the modalities app. You have a ton of cool physical agents to explore. I think this will come in very handy for you. And I want to show you also in your assisted devices and transfers app that we use this as a clinical training tool, but also to teach patients. So the patient says, hey, I got my crutches. I don't know how to use them. Great. This is what I use to learn. So here's a video of how to fit crutches, but it's also something I can send to the patient. Oh, I don't know what type of gait pattern to use. That's perfect because PhysioU has filmed it all for you. Modified 3-point gait, axillary crutches, their right lower extremities affected, and now you can watch a video of how to do the modified 3-point gait pattern. And you can show this to your patient and email it to them as part of your education. This app will include stair training for all the different devices, axillary crutches going up and down, Lofstrand crutches. It includes a bunch of bed mobility, right? How to help patients roll and scoot, how to help patients transfer from one surface to another, right? I'm sure you'll be seeing a lot of these videos. Part of learning is watching, trying, and doing it again and again. That's how you become a motor expert. So it's important for you guys to have this resource with you. And of course, you have basic wheelchairs. We have some case studies for you to use, and these apps are constantly being updated. Lines and tubes is just another quick reference tool that you'll use eventually. Hey, here are all the common lines and tubes you have to be aware of. What it's for, where it's placed, why people use it, and what you should be worried about and what you should be careful about when you're working with patients. So this becomes now a tool. If you notice all the apps that we have here, range of motion, ortho, special test, patient education, neuro, gait analysis, pediatrics, watching the baby develop month after month, cardiopulmonary rehab, right? Assisted devices, lines and tubes. You'll be doing some P&F this semester, splinting and physical agents, and more to come. So I hope that what you see is, one, a few of the apps that are immediately useful to you in the upcoming semester, some ideas of how to use it for your own motor learning, right? Take responsibility for your own learning. You will learn better that way. Use the apps for clinical pattern recognition, developing your pattern recognition. Don't be afraid to explore the apps. I've walked you through one of them. You can learn about all the common patterns that you're going to see in the clinic, okay? And using the quick reference as a way to prep your brain before you go to class. The last thing I will say is we want to welcome you to become part of the PhysioU learning community. So I'm constantly doing webinars for faculty, but we also have webinars that are student focused. This August 25, 7 p.m. PST, if you go to this link, if you go to PhysioU.com under student, you'll see student webinar. We are talking about ACL return to sport. I think you'll find it fascinating. This is one of the founders, Dr. Marshall Lemoyne. He's a fellow. He mentors in multiple residencies and fellowships, and he uses the app and teaches you how to think about different topics. We did rotator cuff, we did impingement, we do a lot of different cool topics that will help you learn better and deeper. All right, so the last thing I was going to say is we love to hear from you. So feel free to email us anytime if you have problems with your app. If you are having problems navigating it, you can always feel free to email us at care@physiou.com. And we are super excited that you are joining the profession and that we get to be a part of your journey in your learning. So, Justin, that's all I have. Are there any comments or questions?
Oh, that was great. Thanks. You guys have any questions that you came up as he was going through there? Okay.
For the webinars, do we register to be able to?
Like, do you have to be a user? So the question
No.
is, do they have to be subscribed to PhysioU to do the webinar?
Right. So no, you don't, because we've done it for everybody. So if you go to PhysioU.com here, let me try to bring you to that. If I go back up to the top under student, free student webinars, you just have to register. Anybody can register here. Okay? So no, you don't have to be a subscriber, but granted, most of you are probably already subscribers, or the program has subscribed for you. So you should be able to join, and I think you'll find it very exciting to be among your colleagues and learning at a slightly slower pace on a more deep topic.
Cool. Thank you. Any other questions? No? Okay, well, thanks for your time, Dr.
Hey, you're
Wall.
welcome.
We appreciate it. Round of applause, guys, for his time here.
All right, guys. Have a great semester. Stay in touch, and looking forward to staying in touch with you. Bye-bye.
Thanks. Bye.
You got it.
Hello.
Hi, I'm ready.
You ready?
Yep.
Hold on. Okay, can you hear me?
Yes, I can hear you.
Okay. I have a question. So right now, when someone sign up, there are like 10 different packages. And I don't know how come we have so many packages for people to sign up. I thought we just have 3.
We should just have 3. So could you share screen? Let me invite you so I can see. Start a meeting.
I don't dare to touch anything. I don't know how does it work in admin, but there are like not 1, 2, 3, 4, 5.
What have they done?
7.
Is it OTU, PT, and AT, and all these little crazy ones?
Yeah, cardiopulmonary rehab,
Oh, okay.
chiropractic, kinesiology, osteopathic medicine. So there's all these other ones that I don't know why they're here, or I don't even know what's the arrangement you have with those verticals.
Well, just think of them as app packages, right? So certain apps eventually, I'm sure this will all be revamped in the new version, but each of them contain sometimes the exact same app, but sometimes they contain different apps, right? So, for example, the cardiopulmonary package, we decided that Ellen Hilligas, who's very famous in cardiopulm, that universities that sign up for her program, the 3-month program, would get like 3 months or 6 months access to only the cardiopulmonary app. So we needed to create that package.
From this page?
No.
They sign up from this page?
No, we basically interface with the programs that use her, that pay her. She pays us a small amount, like $500 or $1,000 for like 15, 30 students, whatever it is. It's just a 3-month package. But we then unlock them using the cardiopulmonary package. We send them codes.
Okay, if we send them codes, then still need to sign up.
Okay.
If we send them codes, they still need to go to this sign up page. Can you share? Can you let me access?
Yeah, let me invite you, and then let me make you co-host. Then you can share screen.
unmute this.
Okay. Can you hear me? Yeah,
Yes.
there you are. Okay. So,
Um,
well, maybe I don't understand exactly how the process goes.
So, okay. I'm talking, so there are a few things. One thing is that, oh wait, I need to share my page, right?
Yeah.
Let's see. Share.